Good evening. This is Dr. John Bennett, another in the series of Parkinsonism medical educational videos with world-renowned medical educator Dr. Abdul Rana, a neurologist from Toronto, Canada. Tonight, the subject is micrographia in Parkinsonism, or difficulty with dexterous movements, which I didn't know what that meant. Anyways, Dr. Rana is going to talk about it, and welcome, Dr. Rana.
Thank you, Dr. Bennett.
Okay, so let's keep rolling on here. Let me start off with a question. What type of fine tasks are affected with Parkinsonism?
Most patients would report they have trouble fastening buttons, or tying shoelaces, trimming their hair, putting makeup, shaving, or brushing their teeth, or chopping food. They feel slow and clumsy, and sometimes they may need help of other people when they're dressing, especially when it comes to these activities. Also, their writing is affected as well. I had a patient who used to tell me all the time that I look much older than my age with my gray beard. And one day I saw him, and he started growing a beard. So I did ask him, I said, why you want to look old? He said, no, I can't trim my mustache or shave anymore. I have difficulty with these fine movements. And so this is a common presentation of these patients, or a common complaint. And it goes with bradykinesia. It's a slowness of movements. It's a motor manifestation, and it's one of the common complaints of these patients. It does get worse as the disease progresses. And sometimes a stage comes when, for most of these activities, they become dependent on other people, unfortunately. These type of problems, to some extent, could be helped by medications, as well as some other techniques, such as practicing their hand grip, taking a ball and squeeze it. It could help to maintain their hand function, or having some support from their family members. The dopaminergic medications, especially in the beginning, could help because till the first few stages of Parkinson's disease, the dopaminergic medication do show a good response, so these patients could benefit from levodopa or other dopaminergic medications. But as disease progresses, then it becomes more and more difficult to see the response from even dopaminergic medications.
Is that one of the first presenting symptoms or signs of Parkinsonism, the difficulty, or micrographia? Is that a very early?
It could be presenting a symptom in some cases. Most patients would be, if they don't have a tremor, they could have slowness of movements, and with other complaints such as their speed of walking has decreased, or they take much longer time in dressing or walking, or with other tasks. So these fine activities always go with the major slowness of movements.
How does micrographia generally present? You kind of covered it, but can you completely cover it, please?
Usually patients would have a decrease in the size of letters, and the distance between the letters would also be less. Not only the size of letters decrease, but also the distance between the letters is also decreased, and this does go along with the bradykinesia, or slowness of other movements, or sometimes with hypophonia. These patients may have softness of their voice. So some reports suggest that they could have more difficulty when they're writing in their native language. The exact etiology is not known for this phenomena. However, the impaired execution of the more frequently used task, it could be the case which affects these patients. So first, their own native language writing is affected. Then the language which they learn afterwards. Some patients may not be able to complete a sentence or write legibly enough. This symptom could improve partially with dopaminergic medications, and as long as the medication is working. When they feel on, they may be able to write better, but when the effect of medication wears off, at that stage they might start experiencing the micrographia or trouble with dexterous movements again. However, some patients, if they use the auditory or visual cues when they're writing, that could help their writing, or the size of writing may stay better if they use those cues. When these patients, they start writing, so at that time the first letter, if you compare, it could be normal or close to normal, but if you compare the first letter to the last letter of the sentence or the last word of the sentence, then you can see an obvious difference that they would start like this, but it goes like this. In our clinic, usually we tell patients to write a very standard sentence, which we compare every time. We tell them to write, today is a sunny day in Toronto, and then the first T of today and the T of Toronto is compared, and there is obvious difference in the size. They may start normally, but they start going slow and slow. And sometimes you can ask these patients to draw multiple loops like this, and you can compare the size of the first loop with the size of the last loop. In the last loop would be much smaller than the first loop. They will go slowly, and the last loop will become really small. Sometimes this could be a presenting symptom. I had a patient who went to bank to draw some money when he wrote a check. So the teller, she compared his signature and refused to honor the check. So she has to check his ID. So she told him that your handwriting is much different. It's much smaller than it used to be, and your signature is affected. So then he came home and gave it more thought, or looked at it, reflected upon this. This is how he presented to his family physician, and ended up being referred to our clinic because he had other subtle signs of Parkinson's disease as well.
You know, it's funny, Doc, I was just thinking that generally other doctors can pick up subtle signs, but a bank teller and a handwriting expert, I wonder if they're familiar with that kind of presenting symptom sometimes of Parkinsonism. But very interesting. Anyways, can something be done about micrographia?
Micrographia, again, is a difficult symptom to improve. It could respond to dopaminergic medications partially, as I said. Otherwise, we advise patients to write in print. If they write in print, they could do better than writing otherwise. And if they practice writing, that could probably help them to maintain their writing. Some reports have suggested using thick pens or pencils, and if they have to do some writing, they should try to do it on time when the dopaminergic medications are working. So they should try to complete their writing act during that time, rather than postponing it to the off times. And also, when they're writing, they should take some rest in between, write a sentence, take a break, and then start writing again. That would help to regain the size of their writing. And if they sit in a comfortable chair and sit upright rather than stooped over it, that could probably help it. These are all individual techniques which we learn from different patients. There are no extensive studies done about these techniques, so these are based on experience of patients and other physicians after seeing a large number of these patients. And sometimes if they do stretching exercises for neck, shoulder, arms prior to writing, that might give them a boost to write, and also paying a close attention when they're writing. So being very attentive of not writing small and keeping their handwriting large, it could help. Also writing slowly rather than writing fast. And some patients report that if they put a rubber grip around the pen where they hold the pen from the fingers, that might probably help. And they should try to avoid doing other tasks when they're writing. They should focus only on writing and writing small sections rather than writing in a big section at a time. Also, using a lined paper might help because lines on the paper might might act as visual cues, and if they freeze during writing, probably those lines could help them. And other cases, they could use a computer or type. Again, difficulty with bradycardia and dexterity will affect their typing as well. Their speed was decreased, but they don't have the trouble to write with the hand then.
How is this writing problem, or what we know now as micrographia, different than essential tremor?
The common complaint of essential tremor is trouble with writing as compared to Parkinson's patients. Parkinson's patient would be presenting with mostly with a tremor or slowness of movement, and writing would be a complaint with it, usually micrographia. Whereas patients with essential tremor, they usually have the chief complaint that they have trouble writing, or when they hold on things, so their hands shake. So writing problem in essential tremor is much more prominent than in case of Parkinson's disease, or at least the patients take more notice of writing problem in essential tremor. Essential tremor is much more prevalent than Parkinson's disease in the general public. Some reports have suggested up to 7% prevalence in people, and it's the most common movement disorder, and starts either in 20s or in 50s usually, and may get slightly worse. But these patients have different type of writing problems. Usually they have large-sized handwriting, and it's more messy. So sometimes it's referred as macrographia, M-A-C-R-O, macrographia, rather than micrographia. And some people have used the term megallographia as well for the writing in case of essential tremor. And the size of the letters is increased, and the distance between the letters is also more as compared to normal. These patients, especially some reports suggest that these patients may have trouble on some letters, especially letter A, T, or R. They might have more trouble on these letters. So their handwriting is more large as compared to the micrographia, which is small, and it is more of tremulous, and also the size between the letters is more as compared to the patients. But in patients with essential tremor, we also ask them usually to write spiral, and you can see the spiral very shaky when you look at it. Also, if you check pouring in them, the pouring of liquids, we could also have some tremor on pouring. And one more difference in essential tremor patients and patients with Parkinson's disease is if they have a drink of alcohol and then they write. So because their tremor dampens with alcohol intake, their handwriting may improve slightly after the intake of alcohol as compared to patients with Parkinson's disease.
Very good. That wraps it up for micrographia or dextrous, difficulty dextrous movements, and another small task. Thank you very much, Dr. Rana. Until the next time, thank you.
So thank you very much.